and joining me is Lou Rossetti. Over the next 3 days, we're going to be having a conversation about increasing parent confidence in children's vaccinations. This program is funded by a grant from the North Central Wisconsin Area Health Education Center, and we are grateful to them. Today, we're going to be exploring the anthropology and sociology of vaccination avoidance. Lou and I are excited to share our conversation with you, and we'll open the floor for discussion towards the end of our conversation today. Lou, this has really been an interesting journey as we explored the history, but also the sociology and anthropology behind it. It seems so simple when we began our discussion of it, but as we've explored it, it has become more complex, particularly as we considered the history here in northern and central Wisconsin related to this issue.
Well, as you know, Carol, we interact with families for a variety of reasons. And sometimes the topic of vaccines does come up, and some of the areas of reluctance that parents have to follow through with recommended vaccine suggestions. And we always try to refer them back to we have to refer them back to their healthcare provider, but oftentimes they have lingering questions. And it has been helpful to understand a little bit, to do some research that relates to the development and history of vaccines. And it is fascinating when you look at the dates at which the first vaccine was ever given, and then the explosion of vaccines, certainly in the 1950s through 1980. I went back and looked, and I did not know much of this. Many of our listeners perhaps do. But the very first vaccine was administered in the late 18th century, 1798. That was the start of it, with one physician administering a smallpox vaccine to a 13-year-old boy. And then we have a gap of about 100 years until vaccines really kicked in again. And then we had a cholera vaccine developed in the late 19th century. And then starting in the 1940s and beyond, right up till today, we have an explosion in vaccines. There are dozens and dozens of vaccines. And that's current in our news media today, obviously. But many of those vaccines relate to pediatric populations. And the development of new vaccines, not just the idea to formulate a vaccine, but the approval process to where it's approved to give is an arduous and long process. And so parents hear about these things, but oftentimes they don't know any of the genesis or history of how these things have come about. And they may have some of their own reluctance and fears from their own past that put them in a place of questioning the efficacy of following through with common medical recommendations.
You know, we've made the assumption that in the 20th century, that vaccinations were common, that they were available throughout our nation, and that is not necessarily true, particularly in rural Wisconsin, in northern and central Wisconsin, where there wasn't the availability of physicians as there would have been found in the larger areas such as Milwaukee or even Madison.
It's not just geography, which is interesting. It's not just geography which impacts the use of vaccines. There's a racial cultural variation that exists. There's an age variation in parents, as I've done some research. There's an educational difference in the level of education in parents. And there's an insurance difference. The number of insured individuals that do not receive vaccination hovers around 1%. But the number of uninsured individuals who do not receive vaccinations is about 7.5%. And we're talking pediatric population.
Yes.
So 7 times higher in some populations. Socioeconomic status, racial status, and demographics in terms of where you live play a big role in who has access to, as well as who takes advantage of the availability of vaccinations.
Historically, people in northern Wisconsin, particularly on the tribal reservations,
Yeah.
there wasn't the information that was available to them about vaccines, but also because of the previous issues related to smallpox, etc., they really were, and maybe still continue to be, reluctant to trust in the science and the medicine related to it. It would. I remember hearing my mother tell stories. Now, my mother would be 111 years old. She's turning 112 in 2 days. Unfortunately, she's not with us. But I've had the benefit of learning a lot of history about rural Wisconsin, particularly northern Wisconsin. And she talked about how she was not even aware that there were vaccines available until the late 1940s, because it just wasn't there. There weren't physicians. There wasn't more of the advancements of medicine that were available to the rural community. And so oftentimes people were kind of left to fend for themselves. I remember her talking about in 1917, and that's right before the flu epidemic of 1918. Her family, the community actually, had an epidemic of smallpox. And she came from a family of 7 children. And her entire family, with the exception of her and her older brother, came down with smallpox. And so there was a quarantine label that was put on the outside of the house so there could be no visitors. And so she and her brother cared for the entire family. She said the doctor would, the area doctor would come for a visit, but he would not come into the house. He stood out on the doorstep and looked in at the family and basically confirmed that they were living. And the milkman would come and they would have to put a pitcher out on the doorstep and he'd pour milk into it because he would not come in either.
Those are incredible stories.
Isn't that incredible?
That many, many people experience. What strikes me as you talk about that, from the 50s till now, I think the medical community has done a very good job in doing its best to educate the public in a variety of ways.
Yes.
But in the era that you're talking about, it strikes me that the whole concept of prevention was not really understood. We dealt with issues after they occurred, and the medical community did not have the information, the database, or the emphasis on preventing diseases. That's talked about extensively today, via lifestyle, via vaccine, via safety measures that we put into our daily experience. Now we're all about preventing diseases before they come. And really, that's the purpose of a vaccine, to prevent something before it occurs. And so the reluctance that people have to engage in preventative activities can be problematic for the medical community in interacting with their patients.
Absolutely. And I think there's another element, particularly in previous years, and that was the issue of isolation.
Yeah, in more rural communities, access to medical care, and as you suggested, the whole issue of quarantine in today's culture is almost impossible to understand.
Yes.
It's more current now because we're dealing with current issues, but who in the 70s, 80s, and 90s understood quarantine? The rest of the world did. We didn't here. And so now with our emphasis on prevention, we have better information that enables caregivers to make good choices as it relates to the medical activity they engage in.
I think also back then it was just expected that people were going to get sick, that children were going to get sick. It was expected. And so there wasn't much thought about preventing it
Yeah.
when it was an expectation.
Yeah.
And I see that true today. And I hear people say, well, these are just normal childhood diseases, and all children should just have them and get over it, and then they're automatically immune.
Yeah.
Why should we bother with something artificial like a vaccine?
One of the greatest responses to that, Carol, is just look at, and I've done this, look at infant mortality statistics going back in history, decade by decade by decade.
Yes.
And what you see is a dramatic shift in infant mortality statistics, lowering infant mortality, birth through, let's say, 12 to 18 months. With the advancement of vaccines, infant mortality has gone down and down and down. And so to say that it hasn't had an impact on survival and quality of life is ignoring the science.
Absolutely.
It's had an amazing impact in the lowering of infant mortality. And even if we look at last year's infant mortality statistics in this country, we look at those factors that contributed the most to infant mortality, basically none of them have anything to do with whether a child was vaccinated or not. That has nothing to do with disease. I'm talking about mortality, which is a big difference.
There is that is a big difference. And also I think another issue is the carrying on of myth.
Mm-hmm.
And I think that that's a myth, that all children should have the diseases, and that will bring about herd immunity, so to speak. I think that that's a myth that just has been promulgated way back from the turn of the 20th century, till now. That's been handed down from family to family. We forget how close many families are, and that we have large, extended families here in northern Wisconsin and central Wisconsin. Everybody's kind of related to somebody else. And so I think, vaccination fears, the stories of individuals having reactions to vaccinations, the belief that you don't need them because children get sick anyway. I think that has just been promulgated from over the generations and are handed down.
The combination of bad science or poorly reported science and rumors that have their roots in fear periods of the past are two conspiring factors that contribute to varying degrees to parents' reluctance to follow through with vaccinations. We've got good science now, and very good science, and we can deal with these any fact-based arguments. We have a good literature base to deal with it. So if a parent comes and says, "Wait a minute, there's a certain percentage of kids that what," we can go to the science. We can go to the numbers in the context of answering, perhaps, or helping them allay their fears.
I think part of that fear comes from their lack of comfort with the science. They want an explanation based upon something that they know or have experienced. It's just like the Andrew Wakefield MMR autism so-called study or publication. What's interesting is that the MMR vaccine is given at about the same time for a child around age 2, when autism really starts to become apparent. And parents will cite, well, my child was fine. It was, my child was developing normally until they got that MMR vaccine, and that's when they developed autism.
So just because things happen together doesn't mean one caused the other.
Right.
Co-occurrence is not causation.
Except that in their mind, it made sense.
That's correct.
Cause and effect. He was fine, the MMR vaccine, now he's not okay. And so that makes sense to them. And I don't know, about the best way to assist people with understanding the science. Even with the science behind COVID-19, there's still people, who are fighting it
Yeah.
and saying it doesn't exist, it's made up, or what?
Well, Carol, you've counseled me before. Facts don't overcome fear.
No.
And that's a powerful statement. And so, as much as we would want to present data and science, if there's an inbred fear with
Correct.
whatever the roots might be of that fear, facts oftentimes, when people dig their heels in, facts don't overcome that fear. And we can develop strategies, all of us as healthcare professionals, to help parents walk through some of those fears in a healthy manner, ultimately leading them to the point where they can make what they feel to be the best decision for their child, even if we disagree with that decision. It doesn't help for me to say to a parent, it doesn't help for me to refer them to a 2019 Journal of the American Medical Association article that followed 98,000 children, showing absolutely no higher incidence of autism in children that were vaccinated versus children that were don't. The numbers are minuscule in
Right.
difference. Pouring those numbers out does not
No.
help the mother who's concerned because her sister has a child for whom there was a correlation between the onset of autism and a vaccination, and correlation doesn't mean causation.
It doesn't mean causation, but yet when we're dealing with them, we need to understand the impact
No.
of historical myth that's been handed down from their families, the experience and that other people that they trust have had, and their own concerns and fears related to their children's well-being.
It's no small thing.
It's no small
It's no
thing.
small thing.
No.
And one of the lessons that I think we've learned as we've been around a little bit is the crucial importance, regardless of how much we would disagree with what someone says, the crucial importance of giving them a voice and letting them speak what they're going to speak.
Yes.
Because oftentimes we hear that one of parents' biggest frustrations is they're not listened to.
Yeah. So at this point, we are going to open it up for discussion with people who may have questions and comments.
So if you have any questions or comments, you can
try and address what questions or comments you might have. It's a simple thing for us to sit and talk forever, but we want you to interject as you choose.
So if you send Mike Slatke a message, I can unmute your phone so you can ask a question.
Well, perhaps, Carol, it might be wise if you give our listeners a sense of where we're headed tomorrow and on Thursday.
Well, tomorrow we're actually going to be talking about the rationale behind where people are coming from, trying to really get a good understanding of the concerns that parents have, the psychology behind that. And then on Thursday, we're going to be dealing with how to work with parents, how to gain their compliance and their cooperation. If we have no questions today, then we'll be signing off. It is 10 minutes to the hour, and we'll be back tomorrow again at 12:30 until 12:50 to continue our discussion.
It's a pleasure for us to interact with you. We wish you a good day and stay warm. It's Wisconsin.
Bye-bye.